The news that a major cause of inflammatory bowel disease has been found has once again put this distressing medical condition under the spotlight. A group of researchers at the Francis Crick Institute and University College London announced in June 2024 that they have identified a weak spot in our DNA that is present in 95% of people with the disease. This system flaw makes it much easier for some immune cells to go haywire and drive excessive inflammation in the bowels, a major symptom of inflammatory bowel disease. In addition, the team found drugs that already exist seem to reverse the disease in laboratory experiments and are now aiming for human trials, reports the BBC. While there is currently no cure for inflammatory bowel disease, the findings present renewed hope for millions of sufferers around the world whose lives have been blighted by this painful and miserable medical condition. But why does inflammatory bowel disease occur, and how can it be managed? Inflammatory bowel disease is a term used to describe disorders that cause chronic inflammation of your gastrointestinal tract. The two main types of inflammatory bowel disease are Crohn's disease and ulcerative colitis. Crohn's disease is a lifelong condition where parts of the digestive system become inflamed. Crohn's disease can affect any part of the gastrointestinal tract. A portion of the small intestine is often affected first before the large intestine. Damaged areas are identified as patches that are next to areas of healthy tissue. As it progresses, the disease may reach through multiple layers of the gastrointestinal tract. The inflammatory bowel disease known as ulcerative colitis occurs in the large intestine or colon and the rectum. Rather than appearing patchy, affected areas, seen as sores and ulcers are continuous, starting at the rectum and spreading further into the colon. Inflammation as a result of ulcerative colitis is present only in the innermost layer of the lining of the colon. Symptoms of inflammatory bowel disease common to both Crohn's disease and ulcerative colitis include diarrhea that lasts longer than a month. Abdominal pain and stomach cramp are also indicative of inflammatory bowel disease. Persistent bloating is also cause for concern. Rectal bleeding and blood or mucus in your stool are other common symptoms of inflammatory bowel disease. Chronic fatigue serves as a red flag. Feeling tired all the time is an indicator that all is not well. Reduced appetite and subsequent weight loss are symptomatic of Crohn's disease and ulcerative colitis. So too is losing weight without trying. It's not clear what causes inflammatory bowel disease, but inflammatory bowel disease appears to be the result of a compromised immune system. Crohn's disease can be described as a chronic autoimmune condition in which the individual's immune system attacks its own intestine, causing inflammation. More precisely, the immune system responds incorrectly to environmental triggers, an invading virus perhaps, or bacterium. This in turn causes inflammation of gastrointestinal. An atypical immune response system malfunction causes the immune system to attack the cells in the digestive tract. 2. There also appears to be a genetic component. You're more likely to develop inflammatory bowel disease if one of your close relatives has it. For example, one of your parents, grandparents, or a sibling. No single test can confirm a Crohn's or colitis diagnosis, and the path to receiving the bad news can be overwhelming. Initial diagnostic work usually includes blood and stool tests, useful for detecting inflammation. Further tests and procedures will follow. A combination of endoscopy for Crohn's disease or colonoscopy for ulcerative colitis and imaging studies. Imaging studies can include contrast radiography, magnetic resonance, imaging MRI, and computed tomography. Treatment for inflammatory bowel disease will depend on your symptoms. Anti-inflammatory drugs are often the first step in the treatment of the condition. These can minimize irritation to the intestines. Antibiotics will be administered to treat infections and abscesses. Steroids may also be prescribed. The aim of any treatment for inflammatory bowel disease is to reduce symptoms, achieve and maintain remission, and prevent complications. If, however, symptoms are severe and medication proves ineffective, your healthcare provider may suggest surgery to remove damaged portions of the bowel. It's important to note that surgery doesn't cure Crohn's disease. Surgery for ulcerative colitis, meanwhile, is life-changing insofar as the procedure involves removal of the entire colon and rectum. Certain foods and beverages can aggravate signs and symptoms of inflammatory bowel disease. Limiting or eliminating dairy products goes some way in minimizing problems such as diarrhea, abdominal pain, and gas. Get into the habit of drinking plenty of liquids daily. Water is best. Avoid alcoholic beverages and carbonated drinks, as these only serve to stimulate the intestines and can make diarrhea worse. Start writing a food diary to keep track of what you're eating and drinking and how you feel. Devise an exercise plan with your doctor. Mild exercise can help reduce stress, relieve depression, and regulate bowel function. And to reduce stress, inflammatory bowel disease can cause use techniques such as deep, slow breathing to calm down. Remember, you're not alone. For example, an estimated 750,000 people in the United States have Crohn's disease. Globally, it affects approximately 6 to 8 million. Join a support group and share your experience with others. This is especially beneficial if you're newly diagnosed with inflammatory bowel disease.